The Oncotype DX test is intended for men who have had a recent prostate biopsy, typically within 6 months or so of deciding whether or not they need additional information about what to do. But really any time, within a few days or up to 6 months is an appropriate time to do this. For men who have already started on a plan of active surveillance, whose last biopsy might be older than 6 months or more than a year, the test will give you some information about what the potential of the tumor was at the time of initial diagnosis. But if you're 18 or 24 months or several years into surveillance, what you really want to know is if you have tumor in your prostate still, what is the current status of that tumor? So for patients who have been on surveillance for a while, more than a year or so, another biopsy is indicated. But for men who are newly diagnosed within the last 6 months and are still considering surveillance, that's the appropriate time to have this test performed.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.